Assalamu alaikum class. I hope you all are fine. Today we will continue with the maternal health, which is an important component of reproductive health. In maternal health, we'll do antenatal care. Antenatal care is the care of the woman during pregnancy, and the primary objective or aim of providing this care is to achieve at the end of pregnancy a healthy mother and a healthy baby. Ideally, this care should begin soon after conception and should continue throughout the pregnancy. So the main objectives of antenatal care are: number one, to promote, protect and maintain the health of the mother during the time of pregnancy. Number two is to detect the high risk cases and give them proper specific attention so that complications do not occur. And number three objective is to foresee the complications and to prevent those complications. Number four is to remove any anxiety related to the delivery or the pregnancy in the mother. Next objective is to reduce the maternal and infant mortality and morbidity in a community. Next is to teach the mother the elements of the child care, nutrition, personal hygiene and environmental sanitation. And the next aim or the objective is to sanitize the mother to the need of family planning services, including advice to seek medication at the termination of the pregnancy. Next objective is to attend to the under fives accompanying the mother. Now, all the objectives are achieved by providing proper healthcare services to the pregnant female during the antenatal visits, which are usually suggested by the WHO. Ideally, it is suggested that the pregnant female should attend the antenatal clinic once a month during the first 7 months of pregnancy, and then twice a month during the next month, and after that once a week till the pregnancy ends, if everything is going normal and if that pregnant female is affording. Now, most of the women in our society belong to the lower socio-economic group, so WHO has suggested that there should be at least a minimum of 4 visits to the antenatal clinic by the pregnant females during the entire period of pregnancy. Now, the suggested schedule is that the first visit should be conducted within the 12 weeks, preferably as soon as the pregnancy is detected, for registration of the pregnancy and for the first antenatal checkup. Now, early pregnancy detection is important that it facilitates the proper planning and allows for the proper care to be provided during the pregnancy for both the mother and the infant. So, the second visit is suggested between 14th till the 26th week. The third visit is suggested between 28th till 34th week of pregnancy. And the fourth visit is suggested between 36 weeks and at the term. Now, when the pregnancy is detected and the pregnant female goes to the healthcare facility or the antenatal clinic, the registration of the pregnancy is done, and the date of the last menstrual period and the expected date of delivery is recorded, and then the mother is told to come for the further checkups according to her socio-economic status. Otherwise, a minimum of 4 antenatal visits are suggested by WHO. In the previous slide, I told you that whenever a female gets pregnant and she visits an antenatal care clinic, or if she wants to get herself delivered at home by the trained birth attendants or the LHV or the midwives, that pregnancy is registered. Now, the registration of the pregnancy is very important because of the proper registration, then we can calculate the expected number of pregnancies per year. Now, all the health personnel who are providing antenatal care, they should know the expected number of pregnancies of that area per year, so that they can have proper supplies and proper equipment so they can provide antenatal care to the pregnant females of that area. So for calculation of the expected number of pregnancies per year, which is designated by Y. It is equal to the birth rate of that area per thousand population and multiplied by the population of that area and divided by 1000. Now, as some pregnancies may not result in live births, like there can be abortions or stillbirths can occur, the expected number of births would be an underestimation of the total number of pregnancies. So, a correction factor of 10% is required, that is, add 10% to the answer which you obtain after calculating the expected number of pregnancies. So the formula is given in this slide, and I'm giving you an assignment that in Sham ki Bhattiyan, the birth rate of that community was 25 per thousand population, and the population under the sub-center which was visited is 6500. So you have to calculate the expected number of live births. Now the answer you can email in the, or you can email to me, or you can write in the comment box. Now, when a pregnant female comes to the antenatal clinic for the checkup, there are certain components which are followed. Now, number one and the most important is your history taking. During the first visit, a detailed history of the pregnant female should be taken. First of all, if it's the first visit, then pregnancy should be confirmed, and there should be identification of any complications which had occurred if there is history of any previous pregnancy. And in the detailed history, the medical, obstetrical, and the surgical or the conditions are identified which can complicate the pregnancy. Now, LMP, that is the last menstrual period, the date is recorded, and the expected day of delivery is also calculated by adding 9 months and 7 days to the first day of the last menstrual period. Now, the symptoms are recorded if there is any fever, or if there is any persistent vomiting or any abnormal vaginal discharge or bleeding, or any other symptom, if it's present, it's recorded. And there is also a proper history taking of any current systemic disease, like if the person is suffering from hypertension, or she has diabetes, or has any heart disease or any liver disease, or like, as you know, hepatitis B and C is very common in our society nowadays. So all these things are written down in the upcoming visit, and especially in the first visit. And the family history of twins or any congenital malformation, and if she has any drug allergies and habit forming drugs is also taken. So a complete history which tells us about the total number of pregnancies if it's not the first pregnancy, and how many live children she has, and if there is any abortion or any stillbirth, that is also properly written. Now, next important component of antenatal checkup is the conductance of the general physical examination. Now, during the first visit or during the upcoming visits, the most important is the presence of pallor. Now, the presence of pallor, it indicates anemia. Now, the woman should be examined for pallor at each visit. The woman should be examined by examining the conjunctiva, her nails, tongue, oral mucosa, and the palms. And pallor should be correlated with the hemoglobin estimation. Next, the blood pressure is taken at every visit. The blood pressure is taken, and it's very important. And hypertension is diagnosed when two consecutive readings, which are taken 4 hours or more apart, show that the systolic blood pressure to be 140 millimeter of mercury or above, or the diastolic blood pressure to be 90 millimeters of mercury or more. Now, the high blood pressure during pregnancy may signify pregnancy-induced hypertension and or presence of chronic hypertension. So blood pressure should be taken at every visit. Now, if she has a blood pressure, the urine should also be checked for the presence of albumin. Now, the presence of albumin, if you get +2 sign together with the high blood pressure, is sufficient to categorize her as having preeclampsia, and this is a danger sign. Next, the normal at every antenatal visit, along with blood pressure, pulse rate is also taken. The normal pulse rate, as you all know, is 60 to 90 beats per minute. So if the pulse is persistently low or high, with or without any symptoms, so that pregnant female coming to the antenatal care needs some medical attention. Along with taking the history, taking the blood pressure, pulse, and checking out the anemia, respiratory rate is also checked. Edema is also seen. Edema or swelling which appears in the evening and disappears in the morning after a full or a normal night's sleep could be a normal manifestation of pregnancy in the later on weeks, but not in the early weeks of pregnancy. Any edema of the face, hands, or the abdominal wall or the vulva is considered abnormal, and she should be referred immediately for further investigation. Now, sometimes the females cannot answer you if they have swelling or not, so you can ask them if they feel any tightening of rings which they wear in their hands. So with that they can be identified as having edema or not. Now, after taking all these things, the weight of the pregnant female is also checked at every visit. Now, the weight taken during the first visit should be properly written, and so that it is treated as the baseline weight. And normally a woman should gain 9 to 11 kg of weight during her pregnancy. Now, excessive weight gain, which is more than 3 kg in a month, should raise suspicion of preeclampsia or multiple pregnancies or diabetes. So, that should be properly investigated. So this is all about the general physical examination which should be conducted at every visit. Next is your abdominal examination. Now the abdomen should be examined at every visit to monitor the progress of the pregnancy and the fetal growth. Now in abdominal examination, measurement of the fundal height is taken, and at 12 weeks the uterine fundus is just palpable in the abdomen. At 20th week, the fundus is flat at the lower border of the umbilicus, and at 36th week, the fundus is felt at the level of the xiphi sternum. So the duration of pregnancy should always be expressed in terms of completed weeks. Next is the fetal heart sounds. Now the fetal heart sounds can be heard after the 6th month, and the rate varies between 120 to 140 per minute. They are usually best heard in the midline after the 28th week of pregnancy, but their location can change because of the position and lie of the fetus. Next are the fetal movements. The fetal movements can be felt by the person who is examining the female after 18 to 28th week by gently palpating the abdomen. So, by assessing the fetal movements, you can also assess the fetal parts. After the 28th week, it is possible to distinguish the head, back, and limbs of the fetus. Multiple pregnancies can also be suspected if the uterus is larger than the estimated gestational age. That can also be confirmed by by getting an ultrasound done. Fetal lie and presentation can only be seen after the 32nd week of pregnancy. So this is the points which should be taken during consideration by consideration by the a person who is doing the abdominal examination. Now, assessment of the gestational age is the gold standard for assessing the gestational age is your early ultrasound assessment together with the fetal measurement ideally in the first trimester. Now, next is the lab investigations which should be done. Now, the lab investigations, when a person comes to the healthcare facility, should be told to get a complete blood count in which hemoglobin estimation is most important, as anemia can be suspected if the hemoglobin content is less. And urine examination should also be done for albumin and sugar. Nowadays, hepatology is also done. Hepatitis B and hepatitis C screening is also done for the pregnant females. Now, next is the high risk approach. Now, this risk approach is asked in SEQs as well, so it's a very important topic as related to your examination point of view. Now, the basic purpose of providing antenatal care to the pregnant females is to identify the high risk cases as early as possible from the large group of pregnant females who are coming for the antenatal visits, and special care is arranged for those who are at a high risk while continue to provide appropriate care for all the mothers who are coming to for the antenatal visits. The females who are at high risk, they are provided special care in along with the basic care which is provided to all the mothers who are coming for the antenatal visit. So the cases that should be identified during the antenatal visit and which are labeled as high risk cases are: number one is the elderly primary, that is 30 years and above. Second is your short stretched primary, that is 140 centimeters and below. And if the pregnant female has certain malpresentations like breech presentation or has a transverse lie, that is also a high risk pregnancy. Now, next is your antepartum hemorrhage, or if there is any threatened abortion, that is also considered as a high risk pregnancy. Eclampsia, a female suffering from anemia or any disease any cardiovascular disease or any disease like liver, like hepatitis B or hepatitis C, or if she has diabetes or tuberculosis, or there is any history of epilepsy or convulsions or any asthma, they are also considered at high risk pregnancies. Now, next are the females who are having twins or having or hydroamnios is suspected, or if there is any history of previous abortions or previous stillbirths, intrauterine death, or if there has been history of manual removal of placenta from the previous pregnancy. Now, elderly grand multiparas are also high risk pregnant females. And another high risk pregnancy is a prolonged pregnancy, like 14 days after the expected date of delivery, and that is also considered as a high risk pregnancy. So, if the person has got pregnant by treatment of fertility, that is also a high risk pregnancy. So, these are the basic cases who comprise the high risk pregnancies, and they should be dealt by the skilled attendants. Now, the high-risk approach, it's a managerial tool for improving the MCH care, and its purpose is to provide better services for all, but providing special attention to those who need them the most. The pregnant females who are going for antenatal visits regularly, home visit is also recommended for them. At least one visit should be paid at home, especially in those females who are interested in getting delivered at home. They usually feel relaxed at home, and the home visit will provide an opportunity for them to observe the environment and the social conditions at home, and also give an opportunity to them for prenatal advice. Now, during the pregnancy, the mother is more receptive to advice concerning herself as well as the baby. So, this is the most important time when different things can be discussed. And one of the most important things is the diet of the pregnant female during the total pregnancy. Now, as you know, reproduction costs and energy. A pregnancy in total duration consumes about 60,000 kilocalories over and above the normal metabolic requirements. Now, lactation or breastfeeding after pregnancy also demands about 550 kilocalories a day. So, child survival is also correlated with birth weight, and the birth weight is further correlated to the weight gain of the mother during pregnancy. As I told you before, that the average weight gain by a healthy female during pregnancy is 9 to 11 kg of weight. Now, several studies have shown that weight gain of females during the poor socioeconomic status, they average around about 6 to 7 kg during their pregnancy. Now, these females, they have the more need for extra calories, and they have more nutrition requirement as compared to the females who are living under middle socioeconomic status, or who belong to the higher socioeconomic status. So, soon after pregnancy, folic acid is started, and iron and calcium supplementation is given later on. And the mothers are counseled about the balanced and adequate diet, which is of utmost importance during the pregnancy and lactation, so that the increased need of the mother and the child is properly catered. Now, next, prenatal advice to the pregnant female is regarding her personal hygiene. Now, personal hygiene is very important. The females should be told that they should take a bath every day and should wear proper clean clothes, and their hair should be neat and clean and tidy, and they should also have a good oral hygiene. Now, the female should rest at least 8 hours, sleep at night, and at least 2 hours rest after midday meal is also advised. They should avoid constipation, should take more fresh fruit, fresh vegetables, along with the other diet which can prevent constipation in them. Now, smoking is another factor. Usually in rural areas or in some of our modern societies, smoking is done. It can be in the form of hookah, or it can be cigarette smoking. They should be told that they should cut down to a minimum, as smoking can lead to low birth weight babies and there is increased risk of prenatal death of the infants. Now, alcohol intake is prohibited in our society, but some of the females belonging to the high social class, they also consume alcohol along with smoking. They should be told that it can lead to intrauterine growth retardation and can lead to developmental delays in their infants. So these are the conditions regarding their personal hygiene which should be told to them. Now, next important thing is the usage of drugs. Now, the drugs are which are not of any medical importance, they should be stopped and discouraged, as they can cause fetal malformations. As you must have read in your pharmacology lectures that streptomycin can cause 8 nerve damage and can cause deafness in fetus, and some of the drugs like tetracyclines or thalidomide also can cause teratogenic effect. So the drugs should be brought to a minimum and they should be discouraged. Next is the exposure to radiation is also a danger which you are giving to the developing fetus. Now, the most commonest source of radiation is abdominal X-ray during pregnancy. So X-rays should be done if they are required, and if it's very essential to get it done, and that should be done with the help of an apron, lead apron in front of the abdomen. So these are the basic things that the person should be told while she is pregnant, that how she should have balanced diet, how she should take care of herself, the drugs and all other things which can harm her as well as her baby should be avoided and that should be discouraged. During the prenatal advice, the mothers should be told about the warning signs. That they should be given clear-cut instructions that if they see any of these signs, they should report immediately to the healthcare facility which is near them. Number one is the swelling of the face or hands or extremities during the early weeks of pregnancy, or if there is any convulsions or fits, there is persistent headache, there is blurring of vision suddenly which can be due to hypertension, or if there is any discharge or bleeding from the vagina, or if she discovers any unusual symptoms, she should report to the health facility immediately. Along with the other prenatal advice, the mothers are also told how they can take care of the child and how they can take care of the all the immunization which is done to the for the safety of the child, and all the family planning education should also be given in the prenatal advice. Now, as we discussed earlier, so there are certain high-risk cases. Now, these high-risk cases are given special attention along with the basic antenatal care. Now, there are certain specific health problems which should be dealt accordingly during the pregnancies, as they can, if not treated properly, can lead to malformations in the fetuses, and can be harmful for the mother as well. Now, one of the important health problem is the anemia. Now, surveys in different parts of the developing countries suggest that 50 to 60% of the females who belong to the low socioeconomic group are anemic, as usually they are malnourished. Now, the major etiological factor being iron and folic acid deficiencies, and if they persist, they can lead to anemia, and there can be high incidence of premature birth, or there can be postpartum hemorrhage, puerperal sepsis, and thromboembolic phenomena can occur in the mothers. So, folic acid is started at the start of the pregnancy, and if there is anemia, the mothers should be treated accordingly. Next is the nutritional deficiencies. Now, if the mothers are not taking proper nutrition or a balanced diet, and they are already malnourished, they can lead to the birth of low weight babies, which can be a problem for the mother as well as the baby. So, nutritional deficiencies should also be identified, and they should be corrected accordingly. Next important is the toxemias of pregnancy. Now, if a female is hypertensive and her urine is also positive for albumin, this indicates that toxemias of pregnancy is present, and that should be dealt accordingly, and it should be early detected and managed properly. Next is tetanus. Now, I'm not going to go into the detail of tetanus, as you will be reading about it in the next coming lectures. Now, if the mother was not immunized early, two doses of tetanus toxide should be given. The first to be given at 16 to 20th week, and the second dose at 20th to 24 weeks of pregnancy, and the interval between them should be at least of 1 month. Now, those women who have been immunized early, a booster dose will be sufficient, and that booster will provide immunity to them for the next 5 years. Next is syphilis. Now, the syphilis is an important preventable cause of pregnancy wastage in some countries. Now, the females who are suffering from primary or secondary syphilis often end in leading to spontaneous abortions or stillbirths or perinatal deaths, or the deaths of the child when they get pregnant. So that should also be treated accordingly. Now, next is your RH status. Now, the fetal red blood cells may enter the maternal circulation in the number of different circumstances, like during labor, or during the performing the cesarean section, or if there is any therapeutic abortion, or external cephalic version, and apparently as spontaneously in the late pregnancy. Now, the intrusion of these cells, if the mother is Rh negative and the child is Rh positive, provokes an immune response in the female, so that she forms antibodies against the blood of the baby, which can cross the placenta and cause hemolysis. So it is routinely advised that when doing the complete blood examination, the blood test is also done for Rh incompatibility. Now, if the woman is Rh negative and the husband is Rh positive, she is kept under surveillance for the determination of the Rh antibody levels during the antenatal care. Now, the blood should be further examined at 28th week and 34 to 36 week of gestation for the presence of antibodies. And Rh anti-D immunoglobulin should be given at 28th week of gestation, so that sensitization during the first pregnancy can be prevented. Now, if the baby is Rh positive, the Rh anti-T immunoglobulin is again given within 72 hours of delivery. So this is how Rh status is important, and it should be dealt accordingly. Next is the presence of hepatitis B infection. As you all know that hepatitis B and hepatitis C is very much common in our society. Now, hepatitis B infection can be transmitted to the baby if the mother is having hepatitis B surface antigen positive along with the core antigen. And the mechanism of perinatal infection is uncertain. Most infections, they appear to occur at birth. Now, the transmission of the virus to the baby after delivery is likely. Both the surface antigen and E antigen are positive, as I told you before. So, vertical transmission can be blocked by immediate post-delivery of administration of B immunoglobulin and hepatitis B vaccination to the baby. Next is about the prenatal genetic screening. Now, prenatal genetic screening includes screening for chromosomal abnormalities which are associated with serious birth defects, or screening for direct evidence of congenital structural anomalies, and screening for hemoglobinopathies and other inherited conditions detectable by biochemical assay is usually recommended if there is some history of any sort of Down syndrome or any neural tube defects are detected. So these are the all the conditions which should be properly dealt, and they should be given special attention. Now, we finish about the antenatal care. If you have any questions regarding this lecture, you are most welcome to ask. Thank you.